Welcome back to Have More Babies. Today, we're taking a focused look at something, well, every parent thinks about, keeping their kids healthy. We've been looking through information from Omega Pediatrics to really get a handle on the proactive side of things,
Yeah.
what it means to go beyond just treating sniffles and scrapes when they happen.
Exactly. We're talking about preventative pediatric care. And it's really more than just waiting for an illness to pop up. It's about actively building a strong foundation for their health right from the start, like planning for wellness.
Okay, so let's get into it. When we say preventative care for kids, what does that actually involve? What are the key parts and why is it so crucial? We're drawing these insights directly from Omega Pediatrics, and just so you know, for a really comprehensive look at preventative care plans and what services are offered, you can always check out omegapediatrics.com.
Right. So the absolute cornerstone, the foundation, is regular checkups. And these aren't just, quick hello, goodbye visits when a child feels fine. Omega Pediatrics really stresses that these are proactive chances to assess everything, their overall health, whether they seem sick or not.
Okay, proactive. Let's get specific then. What kind of things are we looking for in these checkups? What are the goals based on what Omega Pediatrics says?
Well, one really important area is vision screening. It's interesting. Kids often don't realize their vision is changing. If it happens gradually, they just adapt.
Right, they don't know any different.
Exactly. So Omega Pediatrics points out that these routine screenings can catch things early, subtle issues. And catching them early can prevent bigger problems down the road, maybe developmental delays, and gets them to a specialist if needed. You might not even suspect a problem.
That's a huge point. Things we as parents might easily miss. What about hearing? That seems just as critical for learning, for interacting.
Oh, absolutely. Hearing is definitely another key focus. Omega Pediatrics highlights that undetected hearing problems can really impact school, social skills, everything. Sometimes, a child might seem like they're not paying attention or maybe even acting out a bit, but they might actually just be struggling to hear properly.
Like not hearing the teacher's instructions clearly.
Precisely. So regular hearing screenings during these visits are vital. They catch issues early, allow for help, and can just make a massive difference for that child.
It really shows how these basic checks can uncover things with big consequences. And of course, preventative care. You have to talk about immunizations.
You really do. They're such a fundamental part of protecting not just the child, but the whole community. During these checkups, the pediatrician reviews the immunization record, makes sure everything is up to date, administers any needed vaccines. It's that proactive shield against serious stuff. Measles, whooping cough, polio, you name it.
Building defenses, not just reacting. Okay, so beyond screenings and shots, what else are pediatricians looking for during these visits?
They're also crucial for spotting chronic conditions or developmental issues early on, things like asthma, diabetes. Sometimes even early signs of neurological concerns can be flagged through this regular monitoring. Pediatricians track growth, development, check against those milestones. It's a really key opportunity for early intervention if something seems off track.
Okay, so we know these regular checkups are vital, but what should parents actually expect when they go in? Especially with babies, those first couple of years must be busy.
They are. Omega Pediatrics really emphasizes how important frequent visits are then, because development happens so fast. They generally follow the American Academy of Pediatrics schedule, so you're looking at visits around 1 month, 2 months, 4, 6, 9 months, then a year, 15 months, 18 months, and 2 years old.
Wow, that is quite a few visits early on. What happens during a typical appointment like that?
Well, a thorough physical exam is always part of it, measuring height, weight tracking, how they're growing over time, that's standard. They'll also assess things like sensory development, motor skills, making sure they're hitting those age-appropriate markers.
And they use those growth charts, right, to sort of visualize it.
Yes, exactly. Growth charts are a great tool to see the trend and discuss it with parents. Makes it clearer.
Okay. And vaccinations often happen then too, as we said. What about the conversation part? The information exchange?
Oh, that's huge. Omega Pediatrics encourages both parents to come if possible. It's the perfect time to build that relationship with the pediatrician. Ask questions, anything about feeding, sleep habits, developmental milestones, safety, anything.
That's good advice. Maybe jotting down questions beforehand. I always forget mine.
Definitely recommend that. Make a list. Ensures you cover everything you're wondering about.
Makes sense. What if something comes up between those scheduled visits? A parent has a worry.
Yeah, Omega Pediatrics is clear on this. Don't wait. If you have concerns about your child's health or development, contact your healthcare provider. Don't hesitate. Getting attention for potential issues early is always, always better.
Right. Better safe than sorry. So looking at the kind of the bigger picture.
Yeah.
How does this consistent contact with the pediatrician help prevent or manage chronic conditions later on?
That consistency is key. It lets the pediatrician build up a really full picture of the child's health over months and years. Omega Pediatrics points out this regular contact helps spot risk factors early, track existing conditions effectively, and adjust treatments when needed.
Okay.
It's also the time for guidance on lifestyle things, diet, exercise that really impact long-term health. It's an ongoing conversation.
Building that health story over time. So what are some specific things pediatricians do for this ongoing prevention and management piece?
They use a few strategies. Screenings, for one, to catch early warning signs like monitoring blood pressure or cholesterol levels, things relevant as kids get older too. The regular checkups themselves let them monitor how any existing conditions are progressing, watch for complications, and just talk through concerns. They also coordinate care. If a specialist is needed, they work with them, manage medications, arrange tests, making sure it's all joined up.
Like a health quarterback.
Kind of, yeah. And a big part is patient education, helping families understand conditions, set health goals like for weight or blood pressure, and providing resources.
It's clear the pediatrician is central. But as kids grow, they need to start taking some ownership of their health too, don't they? How can parents help with that transition?
That's such an important point for long-term health. Omega Pediatrics uses a good analogy. It's like learning to drive or manage money. Health management is a skill you learn.
Okay.
Parents can start by just sharing basic but vital health info with their kids. Allergies, any medications they take, emergency contacts, that sort of thing. Foundational stuff.
That makes sense.
Yeah.
Give them the basic toolkit. What else? How do we empower them more actively?
Well, encouraging them to actually participate in healthcare decisions is really important. Ask for their input during checkups. As they get older, let them talk to the doctor directly about what's bothering them or ask their own questions.
Building that confidence.
Exactly. It helps them become comfortable advocating for themselves, which they'll need as adults.
Definitely. And what about the day-to-day stuff? Instilling those healthy habits.
That starts young, promoting self-care practices, emphasizing, a balanced diet, lots of fruits, vegetables, whole grains, getting enough sleep, regular exercise.
The basics, but crucial.
Crucial basics. And talking about avoiding smoking, alcohol, drugs, following medication instructions properly if they have them, personal hygiene. And for kids with specific conditions, say diabetes or asthma, really educating them on how to manage it day to day is essential.
It really loops back beautifully to that main idea. Prevention in all these different ways is just the best medicine, isn't it?
It truly is. As Omega Pediatrics emphasizes, being proactive from the start just sets kids up for a healthier life. Regular checkups, the right screenings at the right time, keeping vaccines current, all guided by that pediatric partnership. It's about empowering them to thrive.
Okay, so just to wrap up what we've talked about today, preventative pediatric care isn't just one thing. It's this whole approach. Regular checkups, screenings for vision and hearing, immunizations, spotting issues early, managing conditions, and really importantly, teaching kids how to eventually take the reins of their own health. It's like investing in their future well-being.
Couldn't have said it better. Prioritizing this kind of care is honestly the best strategy for keeping kids healthy and catching any potential problems as early as possible.
Absolutely. And for finding a trusted partner for your child's health. And to really explore those comprehensive preventative care plans and services. Things like early childhood care specifics, well-child visits, the guidelines, immunization schedules. Please visit omegapediatrics.com. You can get all the details there. And you can easily call them to book an appointment too.
And hey, if you found this conversation helpful, if it gave you some useful insights into pediatric care, please give this video a like.
And subscribe to our channel. We have more discussions like this coming up. Oh, and share it. Share it with other parents who you think might find it valuable.
Thank you so much for joining us today on Have More Babies. We really hope this was helpful for you.
Goodbye for now.